My name is Masha Gevorkian. and I'm a nurse practitioner student at United States University. Today is December 14th. It's currently approximately 9 a.m. and I'm going to be recording the musculoskeletal assessment for my patient. I do want to let you guys know I am a little sick, so my voice is gone. I will do my best to speak as loud as I possibly can. So I'm going to do a 360 of my room. The ceilings and the floors. Okay, hopefully you guys can hear me. I'm gonna ask my patient for consent to record this video and post it on an unlisted YouTube channel. Do I have your consent? Thank you. Okay, so I'm gonna walk in. Knock, knock. Hello. Hi. My name is Masha. I'm a nurse practitioner student, and we're gonna be doing a musculoskeletal assessment on you today. What is your name?
My name is Dina Avetisian.
And your date of birth?
11/27/93.
Your gender?
Female.
Pronouns?
Hers. His.
Her. And how did you get here today?
I drove myself.
Nice. Okay, so we are going to be performing a musculoskeletal assessment for my patient. I'm going to start off by doing an inspection. I'm going to be inspecting her hands, her fingers. I'm going to be looking for any swelling, deformalities, redness, and so it's within normal limits. There's none noted, no nodules, no atrophy, no asymmetry, no redness, no arrhythmia, and now I'm gonna proceed to doing an assessment from distal to proximal. I'm assessing the intrapharyngeal joints and metaphalangeal joints and dorsal hands. So no pain or tenderness noted. And now I'm going to be doing range of motion. I'm going to ask you to open and close your fists. Thank you. And if you can flex and extend your fingers. Thank you. Now we're going to be performing an abduction and adduction of fingers. So if you could, thank you. Okay, so findings are a full range of motion, no pains noted, no discomfort. She was able to perform everything that I asked for. Now I'm going to be assessing for swelling, deformities, atrophy, and asymmetry. So none is noted. And I'm going to be moving on to palpation. I'm going to be palpating the metacarpal and carpal tunnel bones. So no carpal tunnel was noted. And now I'm gonna move on to full range of motion. I'm gonna ask my patient to flex and extend her wrist. Thank you. And we're gonna be performing the ulnar and radial deviation. And thank you. So full range of motion, no discomfort. And now we're gonna be moving on to the specialty test. I'm gonna be doing the Tinel's test, which is checking for the median nerve and the carpal tunnel. Okay, so what I did was I tapped over the median and ulnar nerve on the wrist, and I checked for any tingling, numbness, or findings like such, which was not noted. So she had no tingling, no numbness. So she is negative for Tinel's test. And now we're going to be doing Phelan's test, and I'm going to be asking my patient to press. I'm going to be asking my patient to press on the back of her hands together. Back of your hands for 40. Normally we would do it for 40 to 60 seconds, and I would be checking for pain, numbness in the fingers. Any pain, numbness? Okay, so no symptoms are noted in her case, and she's negative for Phelan's test. And now I'm going to be moving on to her elbows. I'm going to be checking for swelling, deformalities, atrophy, asymmetry, and none is noted. My findings are normal. And I'm going to be doing palpation. So I palpated the tips of her elbows, which is the olecranon process, and the medial epicondyle. That's a test for Golf's elbow. I'm gonna check the inside of the elbow, and no pain, tenderness, or abnormalities are noted. So now I'm going to be checking the lateral elbow, and the test is called tennis elbow, and again, it's on the outside of the elbow. Okay, so findings are within normal limits. There's no discomfort noted. Now I'm going to be doing range of motion. I'm going to ask my patient to flex and extend. Okay. Now we're going to be supination and pronation. Thank you. Okay, so findings are within normal range of motion. No pain, tenderness, or discomfort is noted. And now I'm going to be moving on to inspecting my patient's shoulders. So upon inspection, symmetry is normal, bilaterally, they're equal, no tender or no swelling, asymmetry, arrhythmia, or abnormalities are noted. All my findings are within normal limits. I'm going to be moving on to palpating her shoulders. I'm going to be palpating the acromyoclavicle joint, which is the top of the shoulder. I'm going to be doing the greater tuberal, which is the outer arm and near the shoulder. And I'm going to be doing the bicipital growth, which is the front of the shoulder. And I'm going to be moving on to the so far all my findings are normal. So now I'm going to be moving on to doing, what am I missing? I checked the bicipital, and now I'm going to be doing the carcoid process, which is the front of the shoulder near the chest. And now I'm going to be doing the subdeltoid bursa, which is under the shoulder muscle. Any pain, tenderness when I palpate? No. So no tenderness or crepitus noted. Findings are within normal limits. Now we're going to be moving on to the flexation and a range of motion for shoulders. And I'm going to ask my patient to put her hands up, put her hands down, sides, abduction and adduction. And if you can put your wrists up, turn side to side. And now if you can put one hand behind your back, turn from side to side. Okay, so normal symmetry in movements, normal range of motion. Now I'm going to be moving on to the my specialty test, which is called the Amplites test, I think. I'm going to ask my patient to raise her hands forward with thumbs pressing downwards. Okay, I'm going to apply gentle pressure downwards. Any pain, weakness? So no pain or weakness or tenderness are noted, and she is negative for empty can test. Now I'm going to be moving on to her head and neck. So upon inspection, everything is symmetrical, no bruises, no tenderness, no bulging is noted, and all my findings are within normal limits. I'm gonna palpate the head. I'm gonna also palpate for jaw joint front. I'm gonna palpate the TMJ, which is the joint in front of the ear. Gonna ask my patient to open and close. Any pain or tenderness? So no clicking, no pain, no tenderness is noted with the TMJ. I'm gonna move on to the trapezius, which is the top of the shoulder, and I'm checking for a sternocleidomastoid muscle to see if there's any tenderness, and no tenderness is noted there as well. So I'm moving on to the rhomboids, which is between the shoulder blades. Any pain?
No.
Okay, so no pain is noted, and I'm going to be doing range of motion exercises now. So I'm going to ask you to flex your chin up and down. Okay, so if you can extend your head back, forward. We're going to do a rotation side to side, lateral flexation ear to shoulder. I'm going to ask you to open your mouth big and put 3 fingers. Okay, lateral jaw movement, side to side. So all findings are within normal range. She was able to perform all range of motion exercises. We're going to be moving on to a specialty test, and we're going to be doing the Sperling's test, which is checking cervical nerve compression for cervical nerve compression. And I'm going to be asking my patient to extend your neck and rotate it side to side while I apply gentle pressure downwards. Oh, yeah. And this way. Okay, so no radiation pain noted. She is negative for Spluring's test. And now I'm going to be inspecting her feet and her ankles. If you can have a seat, thank you, and raise your legs up. Okay, I'm going to move behind her so you can see. So I'm going to be inspecting for swelling deformalities, discoloration. Normally I would do it with the shoes off. Of course, I would be checking for bunions, plantar warts, calces, or flat feet. And for flat feet, I would normally ask my patient to stand on the floor, and I would see if the inner side of her foot touches the floor. For the purposes of this video, she does have shoes on. And I'm also going to be palpating. I would also palpate her ankles and her feet. So I would palpate her toes, metatarsals, and plantar surface. And there's no pain or discomfort noted or any abnormalities. So I'm going to be doing the mortar neuroma, which is at the plantar surface of the foot. I would be touching toes between the third and fourth metatarsal heads, and to check if there's any tenderness noted. But again, for the purposes of this video, she has shoes on and no tenderness is noted. Checking the plantar fascia, which is from heel to toe, and there's no inflammation noted bilaterally. I'm going to be checking the medial and lateral malleolus, which is the ankle, and the Achilles tendon, which is right here, and the gastrocnemius, which is the calf muscle. I'm feeling for any nodules or tenderness, and none are noted. All my findings are normal. So now I'm gonna check for range of motion. I'm gonna ask my patient to curl her toes in and out. Perfect. And we're gonna be doing ankle dorsiflexation, plantar flexion, and circular movement. So thank you. Same with the other foot. So all findings are normal bilaterally. I'm going to be moving on to her knees, and I'm inspecting and checking for any bulging, any abnormalities, any bruising, redness, nodules, deformities, or asymmetry. Everything is symmetrical, and all other findings are within my normal limit findings. I'm going to be palpating the suprapatellar pouch, which is above the kneecap. Going to be palpating the patella, which is the kneecap, and I'm going to be palpating the popliteal fossa, which is back of the knee. Any pain, discomfort? So no pain or swelling or discomfort noted. Going to be moving on to the range of motion. We're going to be doing active and passive flexation and extension. So I'm going to ask my patient to extend knee to just straight out. Flex the knee, at least we'll do it to 120 degrees. Let's do the same with the other one. Okay, so there's normal range of motion. Now I'm going to be moving on to my specialty test, which is the valgus test, and it's called the MCL, I believe. With this test, I'm going to ask my patient to slightly bend the knee while I apply upward pressure on the lower leg. Any pain?
No pain.
Let's check the other one. I'm assessing the medial collateral ligament, so no pain or instability is noted. She is negative for valgus stress test. Now I'm going to be doing the varus stress test with the knee slightly bent. I'm going to apply inward pressure to the lower leg. Let's do the same on the other side. I'm assessing the lateral collateral ligament, and no pain and stability is noted, so she is negative for varus stress test. Now I'm going to be doing the Latchman's test, and with the knees, for the test, she would have her knees slightly bent, and I will stabilize the femur gently, pull the tibia forward. I'm assessing for anterior and cruciate ligament stability. No excess movement is noted, so she is negative for Latchman's test. Now I'm going to be testing the anterior drawer test, which is the ACL, with I'm gonna ask my patient to remain supine and bend her knees 90 degrees while I pull the tibia forward. Okay. Okay, so no excessive movement is noted, negative for anterior jar test. I'm going to be testing for posterior jar test, and for that I'm going to be pushing the tibia backward while the knee is bent once again. Okay, so there's no instability, no pain, no discomfort. We're going to be moving on to the McMurphy's test. We're just testing the meniscus. I'm gonna rotate the lower leg while I extend the knee. And we're gonna be doing the same on the other side. And normally, of course, I would stand on the other side of the patient. So no pain is noted, no clicking. She is negative for McMurphy's test. Now I'm gonna be moving on to assessing her hips. And I'm looking for any deformity, swelling, asymmetry, and none is noted, so everything is within normal limits. I'm going to be palpating the anterior superior iliac spine, which is the top of the heel, greater trochanter, which is the hip dip, posterior iliac spine, which is back of the pelvis, and sacroiliac joint, which are the dimples on the back. So now I'm going to be checking for range of motion. I'm going to be checking active and passive range of motion. I'm going to ask you to flex your knees to 45 degrees. And the other one? Okay. Flexation, extension, legs up to back, legs up to stomach. We would normally do all of those. We would do adduction and abduction. We would do internal and external rotations, and by having the knees flex 45 degrees. So all my findings are she has full range of motion, pain-free, no discomfort, no abnormalities are noted. I'm going to be moving on to a specialty test, which is the Thomas test. It's the hip flexation contractor test. And I'm going to ask my patient to pull back one knee towards her chest. The opposite leg remains flat on the table while she does that. No lifting of the opposite leg is noted, so she is negative for Thomas test, and of course we would do this bilaterally. Now I'm going to be moving on to the Faber-Patrick's test, hip SI joint test, and I'm going to place the patient's foot on the opposite ankle, and gently press downwards to the knee. I'm assessing the hip for sacroiliac, hip in the sacroiliac joint. Any pain?
No.
Okay, so no pain is noted. She's negative for Faber test. And again, it's the SI joint hip test. No pain, and we do the supine, of course. Now I'm gonna ask my patient to stand, and I'm gonna be inspecting her spine. I'm checking for any curvature abnormalities. I'm checking for scoliosis, lordosis, kyphosis. If I can ask you to bend forward as far as you can. Okay, so everything is symmetrical, no abnormalities noted. Again, no scoliosis, kyphosis, lordosis. Shoulders and iliac crest are symmetrical, and all my findings are within normal limits. I'm going to be moving on to percussing using non-dominant hand to strike. And I'm going to be placing my the flat surface of my hand on her back. Any pain while I do this?
No. No pain.
I'm going to be doing both sides. Okay, so no pain is noted. All my findings are within normal limits. Now I'm going to ask my patient to, I'm going to be doing fixation, so I'm going to ask her to do a forward bend. And now if you can do a backward bend. Okay. And now we're going to do a rotation and side to side. So my patient has full range of motions, no pain, discomfort is noted. We're going to be moving on to the specialty test, which is checking for sciatica. It's called the straight leg raise test. I'm going to ask my patient, we could also do this laying flat, but I'm going to ask her to do it standing while she's standing. I'm going to ask her to raise one leg, keeping it straight as far as she can. Any pain or discomfort? Let's do the other side. Okay, so there's no radiation noted. She's negative for a straight leg raise test, which indicates no sciatica issues. And that concludes my video for musculoskeletal. I hope you guys heard me through the whole thing. Thank you.